I chose radiology at Schulich Medicine and Dentistry because I felt like I belonged. The residents and staff made me feel like I was becoming a part of a little family, and that's what I was looking for.
I chose radiology at Schulich Medicine and Dentistry because of its outstanding resident-centered training, where you can take your learning as far as you want without anyone standing in the way.
I chose radiology at Schulich Medicine and Dentistry because it felt like a home away from home. Even as an elective student, people knew me on a first-name basis. I knew that was a sign of great things to come.
Having experienced and visited multiple sites across the country, I firmly believe we offer the ideal balanced program.
Our program is medium-sized, which means we get an excellent volume and variety of cases, like at a larger program, while having the friendly, supportive environment of a smaller program.
Having a large patient population catchment, London offers everything: a pediatric hospital, the London Cardiac Institute, the Fowler Kennedy Sports Medicine Center, multi-organ transplant program, and of course all the advanced imaging to support these programs, and radiologists who work in subspecialty divisions to offer excellent teaching to our trainees.
Our training is very resident-centered, as there are only a few fellows in any given year relative to the number of residents.
With a smaller group of trainees, they thus have first access to all of these cases and all the procedures involved. In fact, our junior residents learn image-guided procedures right from their first year of the program.
Our staff are focused on ensuring our education and growth as radiologists is a priority.
Our faculty also get to know each resident very well throughout their 5 years and works closely one-on-one with each resident.
We frequently teach each other and share interesting cases. We support each other throughout our entire training journey and have fun together both at and outside of work. Being with this group is what makes coming to work each day so fun. One of the greatest strengths of our program is the support we get for exam preparation, including numerous staff-led review sessions and one-on-one mock OSCEs. Our residents rotate through 3 London hospitals: Victoria Hospital, University Hospital, and St. Joseph's Healthcare.
Victoria Hospital is the larger of the 3 London hospitals. It's a level 1 trauma center and home to the London Regional Cancer Center as well, the London Pediatrics Hospital, and several subspecialty services.
St. Joseph's is the smallest hospital, but it has several very important clinical programs that have been consolidated here several years ago. One of them is a breast program. We have a large breast clinic here that is divided in 2 parts. It's a surgical clinic and imaging and diagnostic clinics. It's where I work.
Today, University Hospital is a subspecialized hospital focusing primarily on neuro, cardiac, and transplant. Within the neuroradiology division, we've tried to embrace a model of the embedded radiologist, meaning that we try not to toil away in isolation, but rather are constantly exposed to all of our colleagues across neurosurgery, neurology, pathology, and ENT. It's our belief that constant interaction and exposure throughout each and every day makes us better and stronger radiologists and improves the quality of our work.
One of the biggest strengths of our program, in my opinion, is the multitude of teaching rounds that we get. On a typical day, we get about 2 hours of teaching, 1 in the morning and 1 at noon. Those rounds come in different formats, including didactic lectures, multidisciplinary rounds, resident-led rounds, and hot seat case rounds. We get so comfortable taking cases that ultimately we are very well prepared to take on the Royal College. And that readiness has been reflected in the past successes of our graduates.
We are at Western University, which has a long-standing legacy of academic excellence and has superior facilities including state-of-the-art imaging multi-center research laboratories to which the residents have access.
London is home to ongoing world-class medical imaging research, and getting involved is as easy as contacting a staff member or research scientist, whether or not you have a specific research question in mind.
A great strength of our program is the early and robust exposure to image-guided procedures and interventions. The relatively lower number of residents and fellows allows us to earn a high degree of trust and autonomy early on.
As a staff, my goal is for all residents that come through here to be trained and fully competent in the basics of interventional radiology, such as biopsies, vascular access and lines, general drains. And then those who are really interested in interventional radiology, there's opportunities to be involved in some of the more higher end cases.
We also like to have fun and relax, frequently going out together as a group and taking part in program-sponsored activities, such as the yearly staff versus residents softball game.
We are in beautiful southwestern Ontario, which boasts the best climate north of the border.
London offers many amenities of city living while remaining affordable and easy to get around. Endless green spaces have earned London the name of Forest City, so opportunities for outdoor fun are aplenty. Numerous bike paths interconnect the city, so many of our residents choose to cycle to work in the warmer months.
London is a great place to raise a family. It's no wonder that many of our graduates choose to stay or return to London after their residency or fellowship training.
You can find more information about our program on our website. Also follow us on Twitter and Instagram at WesternURad. And good luck to those of you entering CARMS.
Choose Schulich Medicine and Dentistry.
Choose Schulich Medicine and Dentistry.
Choose Schulich Medicine and Dentistry.